So I have to push against your orbital bone. Sorry, one little pinch. I put numbing right under there, just a little baby pinch. And of course, this is the thinnest area on our body, and we got a little bruise there. Let me see if I can't push. I'm gonna push down on you because I want to push against your orbital. Use your orbital bone underneath as traction. There we go. There's one though. Thank goodness it came easily, but not without a little black eye you're gonna have. I apologize in advance. I bet I'm not the first lady to give you a black eye though, huh?
Yep, you are.
Hold on here, a little pressure. Well, you know what? You're not the first guy I've ever given a black eye to. I'll tell you that.
Okay.
I've given a lot of black eyes. Primarily because of the surgery that I do here, the skin cancer surgery. But thank goodness they're temporary, and I think at least it can be worth it here because there we go. There it comes. See, I think I caught it all, but I did leave you with a little bit of eye. A little bit of purpling right here. But you should be okay. Okay, let me get the other one here on your. I'm about 5 foot tall. Okay, everybody that sees your black guy to next at church. Goodness sakes. Use our small edge here. Pushing against your teeth here.